Hi, everyone. Welcome to Gratitude Tuesday. My name's Raina. I'm one of the recovery coaches here at Capital Recovery Center. Today, we're going to talk about some self-care in recovery. This is a very important thing when you're someone especially new to recovery. We're going to talk about nurturing both your physical and mental health. We're going to talk about the importance of it in recovery and how it can prevent relapse, and as well some key acts of self-care to connect with other people in recovery. So this article is actually brought to you by GoodRx Health. It's what is self-care and recovery from substance use and addiction. So when you think of self-care, going on vacation or getting a massage probably comes to mind. However, that is just one part of self-care. Self-care is actually taking care of your physical and mental health on a daily basis so that you can feel and perform your best. This is particularly crucial when you are in recovery for substance use disorders, which are often referred to as addictions. So read on in this article about self-care, the role it plays in recovery, and how it can help prevent a relapse to drug or alcohol use. So this is why self-care is important in recovery. There are many benefits to self-care in general, and in recovery, self-care helps you stay on your recovery path. So we're going to talk this first part about what are the benefits of practicing self-care. So this is by actively taking care of your health, you help lower the risk for dealing with problems later. For example, by eating a healthy, balanced diet and exercising regularly, you help reduce the risk of type 2 diabetes. Your physical health and mental health affect each other. For instance, by getting enough sleep, your body rests and you can be more energized and focused on your work. And if you take care of your mental health, it can be easier to get quality sleep. And we talk about that a lot in this meeting about how, going to bed with a more positive outlook on things after doing a gratitude journal or writing a gratitude list, how, changing your mindset from negative to positive can help you with sleep. Goes on to say, likewise, good physical and mental health allow you to work toward your goals. This in turn fosters positive self-esteem. And when you feel good about yourself, you put more effort into taking care of yourself. And that is absolutely true. And it talks, they go hand in hand. So when you're taking care of yourself, you feel better about yourself. And, when you don't, you tend to feel run down or uncomfortable or not in the best mood. So, not only will it help you feel better, but, the things that it can do for your self-esteem can be very, very beneficial in recovery. Because, I feel like a lot of us come into recovery with our self-esteem just, in the gutter. Like we're ashamed, we're not happy with the things that, where we've been, with the things we've done. And it could be, numerous different things, but this will help you, start to feel more positive about who you are and where you are. So it says mental health includes your psychological and emotional well-being. It also includes social well-being, which might not be something that we normally think about as self-care. However, respecting your own boundaries is important. It keeps you protected from the negative behaviors of others, such as verbal abuse or being taken for granted. And that is something, that is often discussed in recovery. Boundaries are very important. And a lot of times when we're in active addiction, our boundaries are blurred. We allow things that when we normally wouldn't. We deal with things that we normally wouldn't. You don't always set healthy boundaries, and learning to do so can be a little daunting, but it is very, very important for your self-care. Not only is it going to help keep negative people out of your life, it can prevent toxic behaviors, toxic relationships, just a whole number of things that, can be detrimental to your recovery. So by putting those boundaries in place, you're actually helping with your self-care in protecting your boundaries and what you'll accept and what you won't accept. So the next part is, how does self-care help in recovery? If you have a substance use disorder, you probably have used alcohol or drugs to escape stressful things or emotional pain. With self-care, you nurture your mental and physical health so that you reduce your chances of turning to drugs and alcohol to cope. Additionally, by physically and mentally feeling your best, you can also work toward your full potential. By working toward goals that matter to you, you have less time to use substances. You'll also have a motivation to avoid them. In fact, people in recovery have reported boredom and anxiety as reasons for relapse. That is very, very common. Anxiety is a big one too. When we start taking the drugs away and here we are trying to learn a new way to live, it can cause a lot of anxiety. And I feel like pretty much everybody I talk to in recovery, especially in early recovery, has expressed that, they have some type or some level of anxiety. And it's very easy to let that take over and, push you back into active addiction, as well as boredom. We have too much time on our hands, mind starts wandering, then the feet start to follow, and before you know it, you're, at the dealer's house. So it's important to find things that you enjoy to fill in where the boredom might be, and it'll help with anxiety as well. So doing things like if you have hobbies or anything like that, it can help relax you and ease some of that. It says other reasons for relapse include a lack of motivators like a job, life purpose, or healthy relationships with others. And I've heard this as well. So in active addiction, some of us work, some of us don't. So when we come into recovery, it's okay, what do I do with myself? Who am I? Why am I here? What am I supposed to be doing? So things like it says, like a job or healthy relationships can kind of fill in there. But it's good to be aware of the fact that, those things can also, without them or stressing too much about them or putting too much focus on them, can also, be detrimental to your recovery. You want to be doing the things finding a job or figuring out what motivates you or being in healthy relationships to be goals, not to be demotivators to your recovery. So it goes on to say, by taking care of yourself, you can help reduce stress and anxiety and fill your time with activities you enjoy. Below, we'll go over specific ways you can do this while in recovery. So the next part is called, how do you practice self-care in recovery? Self-care in recovery includes doing things to keep you feeling your best. It also includes fostering positive and supportive relationships. Very, very important. What are some self-care strategies you can try if you're struggling in recovery? Some helpful self-care strategies that individuals in recovery have shared, including exercising, eating a healthy diet, and keeping busy. Other strategies are, so the first one, maintaining boundaries. An example of maintaining your boundaries is prioritizing the things that are important to you. Another example would be saying no more often to the friend who always assumes you will help them whenever they need you. And again, boundaries are huge. And, there's a little saying that no is a complete sentence. If you're not comfortable doing something or you feel you're being taken advantage of or, whatever the situation may be, you're allowed to say no. And that's very difficult for some of us because we have that people pleasing, mentality going on and other things that could cause us to, not draw boundaries where we should have. So it's very important to know that, you are allowed to say no to maintain the boundary that is going to help you in your recovery. Because when it comes down to it, you're the most important person in that aspect. The next one says maintaining spirituality. Self-care looks different for each person, and religion and spirituality are not for everyone. Some might prefer to volunteer or engage in hobbies, for example. So this one as well, spirituality is not necessarily, does not go hand in hand with religion. They're two separate things. And, this says it might not be, some might not prefer it, but I think it's important that we do have something, in our recovery that we can turn to and something that makes us feel spiritually full. And then the third one is dealing with negative emotions. It's important to face negative emotions and deal with them. This can help you avoid using substances as a way to cope with these emotions. Working with a therapist can help find and discuss the emotional issues that might be contributing to substance use disorder. I think every person in active addiction, in recovery, early recovery, late recovery, can identify with this. One of the main reasons that a lot of us use is because we don't want to deal with those emotions. We don't want to feel those negative feelings. So we just keep covering them up and covering them up and covering them up. And then, you get clean, you come into recovery, and it's learning how to deal with them and learning how to take the negative to positive. And, and working with therapists can be a wonderful way to do that, especially if, you've had past trauma or abuse, any number of things that have led to your addiction. It's always good to be able to have somebody that you can talk to about those things and can help you bring them to light in a positive way in order to work on them and help you, maintain recovery. So the next part talks about how important is social support in self-care. Social support is essential in self-care and recovery from substance use disorders. After all, we are social beings who thrive on healthy relationships with people who support us. The same is true when you are in recovery. Some ways you can build or enhance your support network include joining a support group for substance use disorders such as Alcoholics Anonymous or Smart Recovery. I think 12-step programs are absolutely wonderful. They are a great way to, by working the steps are a great way to help, figure out why you were using, and like the things we just talked about, like you can talk to a therapist about. The step work helps you in that aspect as well, and how to become a better person. And not really that, but it's going to give you the network of people who are all doing the same thing that you're doing, just trying to get another day clean. And it gives you a nice social support in recovery. The next one is opening up about your substance use disorder with someone you trust. You want to be able to have people in your life that you can talk to about what you're going through, what you're struggling with, what's working for you. And it's someone that that is not going to go and, run your information all over town. And someone you trust, and someone who's going to listen and, be a positive force. This is volunteering with a group that has the same passions as you. This one is really great. I like this, that, if you're early in recovery, you're not quite ready for the whole, full-time job type of thing. Volunteering can be a really great way to fill up your time. It can be really emotionally satisfying to volunteer and help out and give back. So that's a really nice way to, do something good for others while also doing something good for yourself. And then the next one is spending quality time with family and friends. Absolutely important. If you have a family that is supportive of your recovery, they're probably so happy to have you, back in their lives as, a person that is growing and doing better. They will be more than happy to spend some quality time with you. And that relationship with family and friends can go a very, very long way. And then the next one is surrounding yourself with those who accept and respect you. And again, could be family or friends. It could be people in the 12-step fellowship. It could be people at your church, like any number of places that you can go to find positive reinforcement from people that care about you and people that you trust. The next section talks about, if I can get off the screen, can self-care prevent a relapse? Yes. Actually, self-care is one of the rules of recovery because stress can lead to relapse. Research has found this to be the case at the biological level as well. Cortisol is a hormone that our bodies release when we are under stress. The more stress we experience, the greater the amount of cortisol our body releases. A few studies have found that increases in cortisol were associated with relapse. In addition, relapse is not a one-time event. Rather, it occurs in 3 stages. So the 3 stages of relapse are: first, the emotional relapse. First, you experience emotional difficulties, and so you might withdraw from others and bottle up your emotions. When you notice this happening, it is a sign to connect with others and share your emotions. This can help keep you from progressing to the next stage of relapse. Absolutely. If you start feeling emotionally, like if you're struggling emotionally, talk to somebody. I know it sounds like, it's easier said than done. And I understand that. But it's very important that, you communicate with somebody about what's going on with you. To help in the prevention of a relapse. Then number 2 is mental relapse. The second stage involves consciously thinking about using drugs or alcohol again. When you notice yourself having such thoughts, therapy is very important. In therapy, you can identify risky situations in which you're likely to relapse. Then you and your therapist can develop strategies for avoiding or coping in these situations. And again, therapists, family, friends, 12-step fellowship, church congregation, whatever that looks like for you, with someone that you can talk to about it and identify what's going on to help prevent it is great. And then the last stage is physical relapse. The third stage is where you actually use substances again. Even though you may feel disappointed for relapsing, it is never too late to get yourself back on the road of recovery. Recovery is a long-term process with ups and downs, and that's very important. So, if you do get to that third stage and you relapse, it is not the end all. It's nobody wants to relapse. But sometimes it happens, and we get ashamed, or we don't want to come back, or we don't want to get involved with these people again, or whatever the situation may be. The physical relapse, it's important to if you get to this point, first of all, you can call us anytime, and we can help you get back on track with detox or inpatient rehab, outpatient, whatever you need. And then, start to identify what brought me to this point. Why did I get back to this relapse? And, find the positive ways to avoid additional relapse instead of, focusing on the fact that you did relapse. Because if it happens, we're not going to judge you. We've all been there. We're here to help pick you back up and walk with you and figure out what was going on and to help in any way that we can. So the bottom line, by putting in the time and effort to care for your physical and mental self, you reduce the chance of health problems later. Self-care strategies can help you prevent relapse and have a successful recovery. Strategies include everything from getting enough sleep to connecting with others and enforcing your boundaries. And therapy is an important part of self-care where you can address concerns that might lead to relapse. So, self-care in recovery, absolutely very, very important. We have to learn how to take care of ourselves, emotionally, physically, spiritually, to help us have a successful recovery. And we here at Capital Recovery Center are, always here to help you with that process. Whether you come in for our groups, you can do our gratitude and self-care group. We have, coffee and conversation. We have a men's group, a family group. Anything that we can do to help you, we are here to do so. So please come on in, introduce yourselves, join one of our groups, and just let us help you. We are that support system that can definitely help you along with things. But thank you guys for joining me, and you are always welcome to come into the center and do these groups in person. We have gratitude journals and other activities that we can do, and we are always happy to see new faces.